Hello, hello, everyone. Thank you so much for joining us here today. We're going to give it just a minute for folks to join, but we really appreciate folks coming and being with us so close to the holidays. So I will go ahead and share my screen. Okay, we can get started. So hello, everyone. Thank you so much for coming and being here with us today. My name is Aurora Grant Wingate, and I work for the National Association of Community Health Workers, or NACHW, or NACHW. We use all the different terms for this. And I work there as their member and partner engagement associate, and I am based right outside of Boston, Massachusetts. Today, we're going to be spending a little bit of time just giving you a little bit of background on NACHW, introducing a couple of our staff members, getting to know the folks on the call, and learning how you can get involved and see our resources. And we should have plenty of time to answer questions at the end if folks have any questions about how they can get involved. So we will get started. Feel free throughout the presentation to throw your name in the chat and meet whoever is in the room, as well as ask questions. We'll have folks monitoring the chat the whole time. And now I'm actually going to pass it over to my team member, Allison, to take us through Mentimeter, which is a new way we're trying out icebreakers.
Hello, and welcome. I'll share my screen. We invite you to, okay, wait a minute. Let me see which screen, 1 and 2. Okay. Sharing the right screen?
Yes, I see it.
Okay, I can't see the border. Okay, great. Welcome. We just wanted to start off with a reflection or icebreaker with asking you to answer, what is your favorite part of serving as a CHW or promotora, CHR, peer support worker, all ways of how we identify ourselves as community health workers. So in order to join Mentimeter, we are dropping in the chat a way to participate. You can click on the link in the chat for Mentimeter, or if you go to www.menti.com and use the code 76659666, you can enter or share your thoughts for the top 3 favorite parts of serving as a CHW promotora. And I think Mentimeter is live, so as soon as we receive responses, we'll have a pop-up of a word cloud. The web page would look like, oh, great, awesome connection.
Folks, if they're having trouble sort of navigating that, they can also drop them in the chat. Happy to put them into Mentimeter that way as well.
Yeah, for sure. The voting option will look like this when you go to the screen on your end. If you click on the link, and we can share the link again, because I know, oops, sorry, people are joining as well. So here is the Menti link again. Awesome. Helping people, community support, impact, connection, meeting new people, providing resources. All right. Impactful advocacy. Yes. Thoughts are expanding. Authentic teaching. Educate and help navigate. Empathy, jack of all trades. Resource guide. So I believe we have about 8 people that have responded. I'm not sure how many have joined so far on the call. But I want to make sure that everyone's voices are heard. hope, support. Support was shared a couple times so that you can see the word support is growing. It's getting bigger. Okay. I think we've I think 10 people have joined, so thanks for joining the reflection and icebreaker. We have a lot to share. Excited to thank you for joining our NACHW and excited to meet you all and see you all. And I'll turn it back to you, Aurora. Thank you.
Thank you, Allison. And folks can let us know how that sort of worked for you in the chat. It's a new thing we're trying out. We want to make sure our events are as engaging as possible. So now to take a little step back, one of the things we like to do at these new member webinars is just sort of tell you a little bit about the story of sort of how NACHW came to be and what we sort of seek to do as an organization. So often what we talk about is NACHW was founded in 2019, so we're a young organization. And this was after several years of planning and organizing by community health workers and allies across the United States. And our vision is really to see community health workers united nationally to support communities in achieving health equity and social justice. And we also like to mention that we use the term community health worker as an umbrella term for the many different job titles that we know community health workers hold, such as promotora de salud and community health representative on tribal nations, outreach worker, resource specialist, and so on and so forth. We want to know that we recognize all those titles and we want to sort of unify the profession and invite all you folks in. So some of the key things that we seek to do is engage community health workers, allies, supporters, partners, sponsors, and influencers, educate stakeholders on the impact of CHW. We want to expand not just our membership, but also recognition and opportunities for community health workers. We're working to establish a national voice in sustainable strategies related to the workforce. And I'll talk in a little while some of the resources we have and the work we've already done in that arena. And we're working to enhance CHW leadership skills and opportunities. We always like to recognize the folks who found NACHW and continue to guide us. You can see some of our amazing board of directors, several of whom helped found NACHW as an organization, and all of whom are terrific leaders in their own right. You can see here the vast variety of states that they come from, as well as they're diverse in the languages that they speak and their race and ethnicity. Many of them are community health workers, over 50%. Some are also identified as promotoras and community health representatives. And in addition to that, many of our board members have founded and continue to work in committees. There is a policy committee which works to review national policy and give feedback. There's a nominations committee that works on who's going to join our board of directors. We have an executive committee that oversees all the operations, provide guidance to the board overall. We have a development committee that works on procuring funds, and a new workforce development committee which convenes to facilitate the exchange of resources and ideas and models. And you can learn more about our committees, and some of them in the next few months will be having new members come on, and someone can throw that link in the chat. We also like to give a shout out to our staff. Here we have our founding executive director, Denise Smith, who might be on the call right now, who is still recovering. And I know several of our other staff members are also here supporting. I want to make room if any of you folks want to come and introduce yourselves. I see Angie, I see you waving. Do you want to come on the mic and say hi?
Sure. Hi, everybody. I'm so glad you're here. Thanks for being a member. My name's Angie Kuzma, she, her. I'm a community health worker in Portland, Oregon, and I work for the National Association of Community Health Workers as the Policy and Advocacy Manager. So really what I'm trying to do in this role that I'm so fortunate to have is to work in solidarity with fellow CHWs to ensure that CHW self-determination and leadership and other CHW values are really infused in any form of policy, local, state, federal, organizational, you name it. Glad you're here.
Thank you, Angie. I also saw Josie on the call. Do you want to come on and introduce yourself?
Hello, everyone. Welcome to NACHW. My name is Josie Scheinlinger. I'm the Senior Operation and Project Manager. Just like you all, I work with CHW and community health workers as well. I mean community health representative at Indian Tribe. I am calling from Yuma, Arizona, and I would like to welcome everyone here. Thank you so much for joining us.
Thank you, Josie. I also want to give a shout out to our comms team, Peter and Carla, who are here supporting the webinar. If either of you folks want to come on the mic and briefly introduce yourselves as well.
Hi, everyone. I'm Peter. I'm a communications coordinator here at NACHW. Love the job. I've been here about a year now, and I'm always excited to help contribute to these kind of outreach events like this and these webinars, and keeping in touch with the community.
Thank you, Peter. And I know Carla's feeling a little under the weather, so we'll have her come on another time. But she's our marketing coordinator. So we have lots of different team members who are here to support and are here if you need to reach out to them for anything. And now we're going to talk a little bit about sort of the benefits of membership. Firstly, just so you know, any one of you on the call is one of over 2,100 members for NACHW across all 50 states and some of the US territories. Here you can see a little bit of where we have sort of the largest amount of members. You see number one is Texas, followed by California. And you can see other Massachusetts and Illinois, we have strong membership as well. Love to know where you folks are calling in from today, if any of these are your states, or if you're representing a state where we have less membership. But we're working to diversify our membership and make outreach in all the states, particularly those where we haven't had as much influence or haven't been able to invite as many folks in. So that's going to be one of our goals moving forward as well. In general, some of the membership benefits, these are going to expand in the year and beyond that, but we have a members only newsletter. We have a directory in the members portal where you can connect to other members. We have our document resource center, which I'll talk a little bit more about later. We have our policy platform and our COVID-19 resources. And we also want to invite you to reach out to us with questions or other things that you might need help with. And I'm going to give you folks a tour of the website after this presentation and sort of show you where some of this lives on the website and make sure you're able to access it. We also are working towards being able to announce our upcoming conference and annual meeting. It will be this summer. We are so close to being able to announce the place and date. So we should have that very first thing when we come back into the new year. We're excited to say that we're going to be in person this next summer, as well as virtual for the first time since the COVID-19 pandemic. So we're very excited to hopefully get to see and meet you all. And we are committed to making sure this is an accessible event. And we're going to have lots of opportunity for folks to come and present, get nominated for awards, and in general, just have folks involved. We're very excited about it. And I'm going to pass it back to Allison to do another Mentimeter poll.
All right, great. We're flying. Okay, so we have a question, or the next question and final question. So thanks for joining with regard to Mentimeter questions. So far we've shared a few resources and initiatives and things that we're doing, I think. And so we wanted to ask you about what programs, initiatives, resources that might be of interest. I did close the voting and I saw some people were voting a little earlier. So Voting is open. This is a select few, not all the resources. So we did include more resources not mentioned. And so that includes, so we have diabetes, COVID-19 resources that we'll talk about, data for action resources, policy and advocacy resources, the document resource center, policy platform, and of course more. So share your vote. We have about 3 people that have shared their vote so far. And we're looking for at least 10 more. What a critical mass. And that's right. So I will also drop, I'm not sure if I dropped this in the chat too. Thank you, Aurora, for dropping in the chat. Yes, please also share in order of preference your top 5. Seven votes so far. Awesome. And for anyone that shared more resources not mentioned, feel free to drop in the chat some thoughts or suggestions or areas that you know of or don't know of yet and want more information, or drop in the chat other resources. Yeah.
Hi, good morning. I'm Susie Pina from Fresno, and I'm so kind of new. I joined different meetings in the past, the last 3 months. I'm Latina. I'm the only one on my organization as a CSW, but at the meeting of my boss, I shared that I'm interested to have more studies about as a CSW. I get the certification from the state of Illinois, but not from California. California, the only school is in San Francisco. It's too far from me, from my place that I live, because I'm from Fresno. So my interest is something like education as a CSW certification, and especially online, or any more education for me. Sometimes I feel insecure to speak English, the communication. Sometimes because the people where I present, they make correction about my pronunciation, but it's unique to be Latina or speak another language. Thank you. That's just my interest.
Thank you. This is all super helpful, both for when I'm going to show you some of the website and resources in a few minutes, and then also for going forward. We know there are a lot of great resources out there, and we want to make sure that we are correctly prioritizing what we get out to you sort of soonest. So this is all very helpful as we move forward. So let me share my screen again. And next, I want to talk for a couple minutes about programs and initiatives we're involved in. The first, again, is our fantastic Document Resource Center. So this is the largest single source database for CHW leaders, state and local government practitioners, employers, and payers. And this is the nation's largest searchable collection of documents on policies around CHWs, most often at the state level. A lot of the documents in there are reports and policy studies, meeting minutes, brochures, state legislative bills, and other materials that show how state level groups have created definitions, policies, and workforce development programs for CHWs. And you can see here we have a little bit around our DRC users by type. State government are some of the top users, payers, and so on and so forth. Also researchers and individual CHWs. I'll make sure to show you where you can find this on the website. And Angie, is there anything else we should add right now around the CHW Document Resource Center?
Yeah, I'll just say, I mean, anybody can use it, and we really encourage you to check it out, use it for your advocacy in your state or your region. And actually, we have some we've done an evaluation on the Document Resource Center recently, so we have some updated numbers here. And CHWs, individual CHWs, are the top user. Yeah, so it's, you know, it's something that really is for us and by us, and we just really encourage you to check it out. I'll put the link in the chat.
Thank you, Angie. Next, I want to highlight our national policy platform. This was something that was sort of developed during the COVID-19 pandemic. You know, our board and other folks we were working with really felt like CHWs were really thrust into the limelight, which was well deserved, but also some folks were not being good allies for CHWs and didn't always know how to properly sort of partner and engage. So this document was created over the past year of town halls with over 30 CHW associations, 3 national polls, and numerous partner meetings, member input, and so on and so forth. And it centers many of the policies and best practices that are already nationally endorsed within the field, and it can be applied to COVID-19 response as well as long-term policy development. This is on our website, free and available to use in English and Spanish, and especially highlights the way folks can protect, respect, and partner with community health workers. We hope this is a resource for folks, and I believe in the future we plan to update it and have this be a living document that we will absolutely provide opportunities for folks to be able to give input on. And next, we want to talk a little bit more generally around our CHW policy and advocacy work. We have had a quarterly policy calls, which are led by NACHW's policy committee, as well as monthly convenings of CHW networks and leadership. We have a really great policy review form on our website that I'm sure Angie can throw in the chat if folks have policy that they want reviewed by our committee, and sometimes they do policy endorsements, as well as we have published reports on CHW policy, such as financing, training on networks, policy, and employer response during the pandemic. We continue to do research in this area and sort of grow. Again, Angie, I want to make sure if I'm leaving anything else or anything else you want to add around our policy and advocacy work.
Oh, thank you, Aurora. So I put the link for our general policy page because it has all of that on there. It's got our policy platform in English and Spanish, policy reports. It also has several other statements that we've made sort of in response to some national policy movement happening. And then if you scroll, it's actually further toward the bottom, you'll find our request for policy review. So that's a way you can request that the NACHW Policy Committee or NACHW staff take a look at a policy that you and your colleagues might be working on. Any kind of policy, state, organizational. We really try to prioritize requests from community health worker networks. So I hope you'll take a look at that and drop us a line if you're working on policy.
Thank you, Angie. Next, I want to just sort of highlight, I know diabetes was one of those top contenders in that poll Allison had up earlier in our Mentimeter poll. So over the last year, we've actually been partnering with the American Diabetes Association around a Focus on Diabetes program, which focuses on preventing intervention and detection of diabetes and diabetes-related eye disease. As part of that, we actually worked with a consultant to create a Focus on Diabetes training, which is free and open to use on our website. This is a training created for CHWs by CHWs, and we hope it can be a help for learning more about and getting resources around diabetes-related eye disease. And you can find that for free on our website. We are also excited to say we just finished our Data for Action webinar summit series. This was to talk about our new NACHW National CHW data on the CHW profession. This was sponsored by Johnson & Johnson's Our Race to Health Equity, which is an initiative to eradicate racial and social injustice. This was a 4-part series which centered the findings of this national survey, which was launched in 2021, which was taken by 867 CHWs across various titles and regions, sectors, race and ethnicity, identities, and values. We have all those recordings up on our website, as well as all the infographics. And we are excited to say that next year we're going to be releasing the full report of all this data. So excited to continue to share that out. And we hope that those infographics are something that you're able to download off the website and will help you sort of talk about your own professional identity and sort of so on. Allison, anything else that I've missed around our CHW data?
That's perfect, Aurora. We encourage you. I'll drop in the chat. We encourage you to check out the website for all the resources for you to use daily or with your organization or with your state or anywhere that you wish. So I'll drop that in the chat. Thank you, Aurora. Thank you, everyone.
Thank you, Allison. Now I'm going to go through this part a little quickly, but obviously, since NACHW is a young organization and we were really founded right before the COVID-19 pandemic, it has really shaped a lot of the work that we have been able to do. To sort of give a little bit of background, we really want to work to amplify the role of CHWs to strengthen the public health infrastructure, both during the COVID-19 pandemic and beyond. Some of the things we've done is create a curated COVID-19 webpage with resources for community health workers that has been continually updated. We've worked to gather CHW data and experiences on CHWs responding firsthand to the pandemic. And similar to the policy platform, we've been working on advocating for national policies and capacity needs for community health workers. And we've also discovered that through the pandemic that self-care for community health workers and the mental health just of the workforce itself is a huge need for a lot of folks, and how to create those boundaries and have conversations with supervisors. And we put together a web page with some resources around self-care. And we seek to continue centering community health workers as leaders to improve COVID-19 emergency response and response to other infectious diseases. We know right now that flu and RSV are really on the rise, and we want to continue to hopefully provide resources for community health workers, because we know that you are all addressing that in your communities right now. This is just sort of a smattering of other things we've worked on during the past several years. We've worked with the American Diabetes Association. We've written blogs on health affairs. We have worked with the CDC to do webinars and trainings, as well as working with Health Begins. So we've really tried to be responsive to the needs of community health workers and create resources where there may have been none. We also last year, just around a year ago, this January, we worked with the White House and in partnership with over 10 national organizations to coordinate a national campaign to get free tests to community-based healthcare workers around the covidtest.gov. We were able to put up a website and do town halls, as well as rapid communications in 5 languages to help bring awareness of covidtest.gov. And we were able to help folks, over 600,000 folks, place orders, and our website actually got over 1.2 million users. And while this was all really great work, what we really want to take away from it is that there is such power in community health workers and mobilizing the community health worker workforce, and that there is a hunger and a need for resources for community health workers and creating better systems to get resources and information out to community health workers. So this was a great case example to us on how getting resources out can work. And we're continuing to seek ways to do this sort of work to both get those resources to community health workers, as well as rapidly mobilize around new developments in public health. And just a moment on sort of news and publications we've been involved in. Over the past several years, NACHW has been mentioned in the Washington Post, US News Today, Kaiser Health News, Health Affairs, so on and so forth. You can find a lot of this on our website if you want to see different things that we've been involved in. We also really want to highlight our newsletter and our social media. Please make sure that you are subscribed to our newsletter. We're pushing things out a couple times a month, such as our events and some of these resources we're talking about. Please follow us on social media. We're also pushing out resources that way, as well as LinkedIn. For most places, we're at CHW National, and we're going to continue to be using our social media and our newsletter. Okay. So now I am gonna sort of walk folks through the website briefly. We know sometimes folks can have a little bit of trouble navigating through our different resources. And then after that, we're gonna launch into some Q&A. Let's see. So our website is NACHW.org or NACHW.org. Here you have the home page where we have our vision statement. Here is where folks can find sign up for our free newsletter. Again, we have our vision and our values, such as self-empowerment and social justice, self-determination, dignity and respect, unity and integrity. And we also have information for folks who want to become members or how they can learn how to partner with us and invest with community health workers. I'm just going to sort of go through each of these one by one. Up at the About NACHW, here you can find a longer sort of description of the organization with some links. And if you want to use the same slide deck that I'm presenting today, you're welcome to download that on our website if you want to talk about NACHW. Here we have, again, a little bit about our board of directors and our list again, and a little bit about our committees. If you want to learn more or reach out to them, we have that information here. And here you can, if you're ever looking to reach out to one of us staff members or to a board member, we have sort of contact information and bios here. I know folks were asking about some different resources before, so we have one heading that's just about resources that you can click on here. If you just click on that, we have a toolkit we actually created for public health departments. And we also have some research we've done about our membership in hunger and nutrition. And we found that many community health workers don't necessarily have reliable access to food, and we are working to lift that up and do advocacy around that. Beyond that, I know folks were also interested in our COVID-19 page. This is something we continue to update. Up first, we have our work with the Vaccine Equity Resource Repository, which is a great resource if folks are looking to download different resources about talking about COVID-19 vaccines in their communities. Then we have other resources. We have one-pagers and webinars that folks can use around the role of community health workers and also things you can take into communities. We have some information about advisories we're a part of and so on and so forth. I know also folks are interested in the mental health and self-care for community health workers. Here we have a recording of a webinar we did with Ashley Rodriguez around self-care strategies for community health workers. We have a little bit of a learning collaborative we did on self-care. And then there's some other great resources out there. These are some workbooks that the NACHW created, as well as a curriculum for supervisors. And here is an interview Denise did with SAMHSA around suicide prevention. And then some other great organizations you can reach out to who work specifically in mental health. And next, I'll just briefly show, we also do have our Focus on Diabetes page. I know I mentioned that before, so I won't get too much into it, but here you can find our one-pagers. in English and Spanish. The training is also available in English and Spanish on our website. We have some joint webinars we did with the ADA and other resources from them. They have risk tests and other great resources. They'll continue to do Ask the Experts and sort of so on and so forth. Next, I want to highlight our policies page. I know Angie mentioned it before, but just to show folks what's there. Here we have our policy platform in English and Spanish. We have some great statements that the policy committee and Angie have worked on NACHW's response to CMS and proposed amendment to the Public Health Service Act and HRSA's Community Health Worker Training Program. These are all free for folks to download and read. And then we have various policies around COVID-19 vaccination and statewide training approaches, assessing the CHW workforce and crisis to opportunity around what CHWs want from employers during the pandemic. A really fantastic resource on sustainable financing for community health workers. This is by Carl Rush, who is sort of the godfather of sort of Medicaid reimbursement and other things around CHW financing in the US. And here he's done a webinar as well as a brief and a full report about that. Another link to our document resource center, and then some other really important work being done out there that we sort of endorse, which is the CHW Core Consensus Project and the CHW Indicators Project. And then here again is that policy review form that Angie mentioned for folks to submit things that they might like to have the policy committee respond to. Next, under policies, you'll be able to find our document resource center. I'll just briefly show folks what that looks like. We have a great description here just so folks know what they can find. And then folks can go here and click on Get Started. We do have a little brief quiz to make sure folks have the opportunity to give us feedback on the DRC. And then we're going to go there. And then if you scroll down, we have this really great search function if you want to use some keywords and search that way, the Document Resource Center. And then we also have different sort of filtering. You can do it alphabetically or by year. You can search specific states if you want to see what's there for your state. We know that these are some of the top things folks are often asking us about, such as certification. We have some different topics related to certification or sustainable financing, as well as the policy development process, workforce development. And you can even sort of filter by a year range if you're interested. So again, Paul, the Document Resource Center is something that is sort of in progress. And I'll let Angie say a few words about it again.
Yeah, no, thank you so much, Aurora. Just two things. The Document Resource Center is expanding. So we're excited to enter into that work. And some of you may have even heard about the feedback session we recently did to explore some of the concepts that are going to help us do that expansion. And also you can contribute to the Document Resource Center. I think on the landing page or I think it's the landing page. There's a link where you can just submit and upload a document, and it will get reviewed and most likely be added to the database. So you can help contribute to this. Thank you.
Thank you, Angie. No, that is vital. We want to see what you guys want to include. So that is under our document resources on that homepage, like Angie said. Now, I do want to leave time for questions. So just briefly, other things we want to make you aware of. We do have a membership page, but folks here are already members, but folks can sign up right on our website. We do have a page, which is a list of CHW networks and training programs. This is something that we're working to update, but we have list of state associations. If folks ever found new associations, feel free to email us and we can add you to this page. And then we also have a list of training sites here if folks are looking to get training in their specific area. And then we also have a news page where we post different blogs. Right now, we just have a fantastic piece by Alice Ferguson, who is a CHW. And this was sort of written for World AIDS Day. And sort of she writes about centering lived experience and lessons from the community, reflections on HIV/AIDS. But then we have other blogs and news. Earlier this month, we had committee applications open, so we posted that there. We have an events tab, which you can click on, and we don't have webinars scheduled right now. This is our last one from the year, but you can always find our webinars there. Or if you hover over the tab, you can see some sort of recurring events we have pages for that you can view. And I will click on the data for action. Just to show you, again, you can watch the recordings from each part of the webinar, as well as download these really fantastic handouts around the sort of data that we gathered from the survey. This is a really interesting one, just around the sort of composition of the profession. We've learned so much around the languages that community health workers speak and education levels, and we want to make sure that this is free and available to anyone who would like to use it. And last but not least, we have our Connect page. If you just click right on that, we have some links to our social media. Oops, looks like our Instagram link is down. We can fix that. And then we also have a partnership and sponsorship page. Here is sort of a curated list of resources if folks want to work with us. As well as we have sort of a meeting request form. If folks ever want to have a meeting with one of our staff members, you can fill out this form. And basically, I will email you within a couple days to either help direct you to the right organization or resource, or just meet and see how we can work together. And again, we have our great policy review form and some opportunities around sponsoring for the Unity Conference. Okay. Now let's see, I wanted to make sure that folks have time for questions. I'm excited to see we have 35 people on the call. So now I want to go ahead and open it up to the floor. Feel free to drop questions in the chat or come off mute and ask your question to the group. And I know I got one question around, someone had a question around their account. And if folks ever have that kind of issue, either accessing the account or maybe a general question you don't know who to address it to, you can email info@nachwa.com and they will help direct you to the sort of right person for your question. I see that Destiny asked, how do you join one of the committees? Unfortunately, the applications for committees just closed, but they will likely open again in the year. So at that point, we will put out an application and then the committee reviews it and sort of selects the folks who are able to sort of take on that responsibility. And I can drop that in the chat if folks have any sort of questions or want to get in touch with the committees in the meantime. That's a great question. We will also in the new year be looking to bring on some NACHW ambassadors. These will be a whole nother sort of committee where folks will join us to help spread the word about NACHW membership, as well as join us and help with the Unity Conference. So again, make sure you're subscribed to our newsletter to get updates around that in a few weeks. I see David put in the chat, for those that applied for a committee where there'll be an update on decision of membership. That's a great question. I don't know for, yep, Josie, you want to take that one? Thank you.
Yeah, I can only answer for development committee though. For development committee, they have selected 6 applications, and those applications are being reviewed right now. And we will make an announcement when we resume in January 3rd. That's the next monthly meeting for Development Committee. Development Committee meet once a month, and usually the first Monday of the month. But unfortunately, for the first Monday of January, we are still closed because of the New Year. So it's gonna be first Tuesday on January, but the following in February is gonna be the first month. So you will hear from us from the Development Committee if you've been selected, and we'll be doing the introduction to the committee on February. Thank you.
Thank you for that update, Josie. I also see Panther put in the chat, will this presentation be sent for us to watch or on the website? Yes, both. We do have a YouTube channel where we upload all of our webinars that we do, as well as after we do a webinar, we always email the slides and the recording out to the folks who register. So keep a lookout for that in the coming days. We'll send both of these out.
Aurora, forgive me if you mentioned this and I missed it. Heather Hanos with the CSIU in Pennsylvania. We work in an area where it's pretty rural, and I don't know that a lot of people are hiring. We hope to change that. Do you have any sections on your website, or do you do any webinars on how to help community health workers find jobs, and also how to penetrate new markets where providers may not even realize that they need to employ community health workers?
Heather, this is a fantastic question. So firstly, I apologize. I forgot part of the website tour, which is actually our membership portion where after you sign in. Give me 1 second to get back to that. Because we do have a place for folks to post job opportunities. So when you go to our homepage, you can go to log into your account. You put in your email and then your password. Oops. I do this every time. Oops. 3rd time's the charm. This time it'll be right. There we go. You won't have this black bar at the top. That's my administrative bar. But here is sort of our membership portal. One thing to note is once you're in the membership portal, you want to stay down here for these options, because this keeps you in the portal and this brings you back to the regular web page. In the next year or so, we're actually working to put together a new website, which has a little bit of a better member sort of portal. But anyway, this is where you can find the member directory and different resources, opportunities, and members only events. I believe we also have a place to upload resources. This is sort of just members only resources, but here we have some self-care webinars and some other great resources. And then here under opportunities, we do actually post jobs. We also send out job announcements in our newsletter and on our social media. And the info at NACHW.org is another place folks can send job announcements, but I also really encourage folks to get connected to their local or state CHW association. Many of them also do job announcements. And again, we have that list on our website, but if folks also ever need help getting connected to those resources, please feel free to reach out and we can help make those introductions. The other thing you said, Heather, was sort of, do we ever have opportunities to educate employers about the value of community health workers? I think that's a really incredible question. And the short answer is yes, we do want to continue to do that. And we try to do that through our policy platform. We also provide some technical assistance to different organizations looking to improve those sorts of hiring and sort of making the case for community health workers. So I think yes, and also sort of more on that to come. We also know we want to provide more resources for community health workers to also be able to do that for themselves and sort of make the cases to their communities. I know, Angie, you just came back on camera. Did you have something else you wanted to add to that?
This is one of the areas of expansion for the Document Resource Center. So you'll be able to access a lot more resources on that topic in the new year, hopefully after some time in the spring, I think, tentatively. But I'm also thinking of this great one pager by one of our partners, the ASTO. I don't remember what that stands for, even though I know. Aurora, you probably know. That has a real great like summary of just the last 60 years of research that's been done about community health workers and our effectiveness. And I am going to try to find that before the webinar is over and put it in the chat.
Yes, and ASTO is the Association of State and Territorial Health Officials. We have a lot of acronyms. Happy to help anyone with that. Yes, thank you, David. I think that was the question around in post-employment opportunities. Yes, we do. Also looking to sort of improve that process. And then I see you also put a question. Does NACHW have data on CHW pay range, including breaking down pay based on state and county level? Also a portal or means that CHW members and allies can input this data so they can get up-to-date pay ranges. So that's a great question. Our CHW data of the national survey we just did doesn't include exact pay ranges. We have gotten this question before. What we do have is some self-reported data around how if CHWs feel they're being paid equitably, and we can drop some of that in the chat. So right now we don't have that resource. The only place I know of that does that is the Bureau of Labor Statistics. We're often a little wary on how accurate that can be because it's an underutilized category, the CHW employment category. And thank you, Allison, for dropping in that infographic. But we know that's been a request from other people who are interested in those pay ranges. But no, we don't have that to provide right now. But thank you for that question. We have a couple more minutes left together. Again, folks can feel free to come off mute and ask a question or drop something in the chat. Okay. Well, if folks don't have any more questions, I also know I threw a lot at you today, so feel free to take it in and always feel free to reach out. I'll also drop my email in the chat. If folks have other specific questions around resources or want to get connected to partners, that's sort of my area. Happy to help out with that. But otherwise, thank you all so much again for spending an hour with us right before the holidays. We're so excited about getting to spend the next year in 2023 with you. We hope to see many of you apply to be our ambassadors and come to the Unity conference. And we're going to have a lot more opportunities in the next year to come be on virtual events with us, some in-person event opportunities, and other ways that we want to lift up your leadership and expertise. So please keep an eye out for that. And we look forward to sort of bringing in the new year with you all. Please feel free to reach out if you ever need anything. We want to be a resource for you. Any of my other staff members, any final thoughts or words? I see Josie put something in the chat. Yes, okay, happy holidays. Please, everyone, take care of yourselves. We know sometimes this can be a difficult time of year for folks, but we want to have everyone take care of yourselves, take care of your families and your communities, and we hope to see you all in the new year. Thank you so much.